Acupuncture can be used for a whole range of conditions, but I suppose being in the physiotherapy business, we use it to treat mainly musculoskeletal problems, people who have pain. So anything from back pain to disc problems, pretty much anything at all that's painful and sore, we can use acupuncture to help. Dry needling is a form of acupuncture. Dry needling targets more specific, what we call trigger points within the muscle itself. The most common one that we would needle is what we call your trapezius muscle, which is up here, comes from your neck and into your shoulder. What you're trying to elicit is a twitch response. So you actually see the muscle kind of twitch, or you can feel a twitch underneath your hand when you place the needle in. And it helps kind of dissipate the tightness in the muscle, and afterwards you can all feel a lot more relaxed. Acupuncture is so that it's slightly different to dry needling, so they still use the same needles, but acupuncture has its origins in traditional Chinese medicine, which is to do with the flow of energy within the body. And they believe that there's specific, what they call meridians and lines throughout your body in which the energy flows. The Western philosophy is slightly different. It's believed more in the Western world that it's to do with kind of stimulating local inflammatory response and increasing blood flow to the injured area, which in turn helps stimulate the healing process, can also help with kind of pain mechanisms. You can sometimes get different sensations when the needle has been placed in. Sometimes people get kind of feelings of warmth or tingling. So depending on obviously the area that's been treated, you kind of tell them how many needles I was going to insert, and I said they have to be stimulated then to elicit what we call a response, a qi response, which would be the more traditional Chinese approach. And then so depending again on the severity of the condition, the needles will be left in between kind of 10 minutes and 30 minutes. Bar the initial, so when the needle is inserted, is that you feel a slight pinch as it goes into your skin, and even at that, a lot of people don't even feel that when that happens, but otherwise it shouldn't hurt. With the dry needling, you can see some instantaneous effects, and so depending again on the kind of severity of the condition, it may take kind of a couple of sessions. And so we do have some patients who they find that, say, dry needling, like I was saying again, in this trapezius muscle up here, that's worked best for them, and they would come in maybe when they know themselves their pain is getting worse, and they will come in for more sessions. But generally with the more traditional acupuncture, it's a cumulative effect, so kind of looking at 4 to 6 sessions need to establish if it is going to be beneficial for your condition.